Wonderful. So yes, my topic today is about the use of herbs to help people who have pain from cancer, and we will then sort of digress into, some discussion of the effects of these herbs for other kinds of pain, just to support their utility. So I thought we should start with Corydalis, or some people say Corydalis, who knows the right way. And I am going to talk about the Chinese species Corydalis yanhusuo, um, because we have the most information about it in terms of how it works, that it does work, and dosing and so forth. There are many species of this that are native in North America. So other herbs and their constituents have been shown to act on the kappa opioid receptor. And by far the most potent demonstrated to date is Salvia divinorum, or the diviner sage. And it has a diterpenoid, salvinorin A, which is a very avid, has a very strong affinity, very avid binder of this kappa opioid receptor. So other studies with other kinds of surgery kind of consistently confirm that it reduces pain and that you can use far less of other drugs. We've also got one case series that suggested just crude aconite is helpful for herpetic neuralgia, post-herpetic neuralgia, a neuropathic pain problem. And so these arrhythmias can lead to ventricular fibrillation and death. This is actually the Chinese herb that has caused the most deaths of any other herb, but we're still only talking about a couple of hundred confirmed cases out of literally tens of millions of users in China every year. And almost all of the cases involve people self-treating, including a lot of people who apparently it's a fairly common folk treatment to use that sort of unprocessed root or of the Aconitum kuznetsovii topically to treat pain, and they basically treat like their whole back if it's hurting, and then they absorb too much and it can be lethal. There is very little research about cannabis or any of its constituents for treating cancer pain. I felt like going into researching this, and I think it's still true in most people's minds. It's like, oh, that's a slam dunk. That's been studied for years. No, I really could find only this one study from freaking 1975. And then we'll see some of the isolated constituent stuff looks pretty pitiful.